You guys haven't met before.
No, we have
No.
not.
Yeah, and I thought this would be more of a meet and greet. Yeah, there you go. Meet and greet, and also like a think tank as to other subjects perhaps, or things that you might be interested in and having a discussion about.
I was going to say that every time I'm on, I leave feeling like Dean Martin because I'm always drinking and smoking.
Yeah, it's okay. Well, that's all right. We'll still talk to you. Yeah. Can you sing though? That's the thing.
I'll go
bit.
get my tap shoes on and put on a black face.
Yeah, yeah.
I can be
Thanks,
Sammy Davis Jr.
yeah.
Interestingly enough, at my father's 93rd birthday celebration on Sunday at my sister's, which was a very nice event, for the grace, my dad traditionally says grace. I sang the old Irish blessing.
Oh, but how does that go?
Well, there's many different renditions. Would you like me to hum a few bars?
Well, sure.
So, may the road rise to greet you. May the wind be always at your back. The sun rise up upon your face. The rain falls soft upon your fields. And until we meet again, may God hold you in the palm of his hand.
Okay, very nice.
Very good. I don't mind talking about some of the things that are going on in Alberta regarding the current government's, let's say, take on what the tax structure should be and what they think they're going to be giving us in return, because I think that also leads into federal and leads into Wexit. And so all of that is good, or any component of it, including healthcare.
I have some concerns regarding healthcare, where this province seems to be going. I know, Randy, you and I touched a little bit on the whole privatization of healthcare. And I mean, there's always been an element of that, but I think there's a lot of people who are afraid of what appears to be abandonment of healthcare system as we know it right now, or a push towards privatizing it more, maybe having a two-tier type thing. So I mean, that's a concern, I think, for a lot of people, something we could delve into.
We could even discuss, or at least define what we feel is privatizing healthcare and two-tier, because I believe they're two different things.
Well, let's start there. It's what's your definition then of what we have in terms of healthcare?
Well, what we have now is a combination of public and private delivery of healthcare, and I can see that growing personally. I don't have an issue with it. Two-tier is a little bit different. I get access to, for argument's sake, recognizing that not everything is equal, I get access to the number one doctor, you in the number one center, and you get access to the number 50 doctor in the number 50 center. Right? To me, that's two-tier. For regular healthcare delivery, paid for by the public purse, having what we have now, because right now, if you look at things, especially from my experience of your eyes, that alone is two-tier. And if we are not two-tier, but pardon me, but it's privatization of healthcare delivery. And if we can do some more of that to increase delivery and the amount of delivery, I don't have an issue with
Comment on it. I require some clarification so that I'm starting from the same base as what Randy said. Yeah. Because for me to give my interpretation of what I think it is, in fairness, I think what makes for fair discussion and debate is that you have a common starting point. So Randy, you're saying that if I live across the street from the U of A hospital or the Calgary Foothills Hospital and I have a serious accident I'm in arguably the number one center with the best doctors. Whereas if I am in Mundare and I have an accident, I'm perhaps getting doctors that are not as good because they can't go into the top slots on a competitive basis, or that's what I need clarification on. That's what I heard in terms of a two-tier system.
Oh, okay. To me, a two-tier system is much like, and I've never bought healthcare from the States, but the impression I get from the States is if I've got more money, I can go to the U of A. If I don't, I have to go to the free clinic. And to me, that's two-tier.
Correct. Okay.
Right?
I do not perceive that we have that system in Alberta.
No, and I have to agree with you, but for argument's sake, on our government's last go around, shall we say, for healthcare, they proposed that there's doctors who could open up a hospital and do certain selective surgeries and deliver it totally outside of the U of A hospital.
Okay, and to me
People
that
fall on that as two-tier, and I fall on that as, no, that's just delivery.
yeah, and I would deem that to be privatization.
Oh, definitely.
You've got the money, you've got the private. Yeah. See, in Canada, the premise that I understand, and where it gets very murky, just plain either invisible or so black you can't see it, is that I don't, for an example, and I'll digress here for a moment. This whole thing with Chandro showing up at somebody's place over, I know nothing about that incident. I do not like Jason Kenney. I do not like the party. I don't know Tyler Chandro, but from what I've seen and the way he presents, he comes across to me as a pompous, little arrogant, little entitled prick. What we don't know in this province is that we don't know how this vast delivery of health services even begins. I said what I need to know, and what everybody needs to know before these discussions come up and become sometimes heatedly debated, is that I need to understand how the current system works. So what I was saying is that my understanding is that you've got all of these taxes that come into the provincial treasury, corporate tax, commercial tax, private, income tax, everything. So all this money gets dumped into the trough. Alberta Health Services receives a percentage of it based upon budgets that are done by the regions, and then it's allocated as such. And if the budgets come in and it's too much money, they say, no, we got to cut it, which is maybe a cutting of delivery of service. And then basically everybody gets their piece, and they go out and they contract the doctors and pay for the doctors and the nurses and all of this. And it's a real mishmash. It's a
privatization of healthcare goes. When I needed my cataracts removed, then I ended up with torn retina. Before they would remove them, that had to be fixed.
Right.
And I went and I got that fixed all very quickly. Then the cataracts removed, like as in lenses and the whole 9 yards. And it cost me nothing.
The thing is, it doesn't cost us anything for a procedure to be done. However, I guess there is a wait time sometimes required because of the number of people requiring the surgeons or time and the facility to be available, et cetera, et cetera. So sometimes there's a wait time involved. Whereas I guess my understanding is that if I've got money, I can say, fuck that, I'm going to go to so-and-so. I can be in there within the week and have it done and taken care of.
That's two-tier.
That's two-tier pay, yeah.
Okay. And at least to me, that's what I consider two-tier. Okay. We have a hospital sitting there, and it's got 20 operating rooms, and I get in because I got $10,000 and you rely on the public purse. That's two-tier.
Okay.
I view that, I don't like to see that already exists in Canada, by the way. It exists across this country.
Right.
I'm not keen on that. but I do support the idea, providing it's an honest idea, that if a set of doctors with their investors want to build a hospital with 20 operating theaters, and what they want to do is do knee surgery. I'll take knee surgery because that's getting backed up the honhoonie. If they want to do knee surgery and they can target that and do that surgery every bit as successful as me going to the U of A, then let them do it. They're getting the money. What they're doing is maybe figuring out, for argument's sake, that they don't need 24/7, 7 days a week staffing, et cetera, et cetera. Do you know what I mean? Like I don't know how open they would be. I know the private clinics that are doing something, they all have certain restrictions, like they're not going to be open on Sunday, or they're not going to be doing midnight, right?
Right.
Type procedures. So if a knee surgery costs $10,000 and somebody wants to put up 20 operating theaters and do those procedures for $10,000, and they can do it successfully, and we've just quadrupled the amount of knee surgeries we can get done in a week, I don't have an issue with it. If we set it up so we can do that and we get caught up and now they've got open space, if they want to present to take on hips, again, I don't have an issue with it. If they want to go one step further and say, I'm going to build a hotel next to it, because I know when I had prostate cancer, this is what it sounded like as one of my options to go to Toronto, is it was a private clinic. I could go there, get my prostate operated on, and leave. And it wasn't going to cost me anything. Or you happen to have 20, and I forget what it was, but you happen to have $25,000. So you can go there, get yours done, but your convalescence is there in the 5-star hotel room. And I don't have an issue with that either. If it goes beyond that, where people jump queues, then I have an issue. If you want to jump a queue, then pay the piper and go to Las Vegas, go to San Francisco. I don't care, go anywhere. But to me, that's not what I view as healthcare for all.
No, I was going to say the one issue that can become complicated with that, and I don't disagree with what you've said necessarily, but the one issue that can become complicated is that there are people that will then say, wait a minute, we're all paying for equal access to the system, and now you're taking resources out of the system, putting them into private centers, and I've lost that resource.
Now, would we be taking that doctor out of the U of A into a private, or would we be turning it around and saying, eye surgery is an excellent one. Gimbel started it back in the early 80s. Would we have somebody going down, getting specific training, coming back and joining the private hospital versus the public hospital? And I think that's where it would more or less be.
Well, it depends on whether the doctor truly follows the Hippocratic Oath and is altruistic, or whether the doctor is driven by the status and the money, because there is absolutely no doubt that those involved exclusively in the private system that are good are compensated at a great higher level than those who are compensated in the public system.
And that would be interesting too, because and I don't know what it costs, but if the figure is $10,000 to do a knee operation, and they're going to do it in the hospital for the same cost as the U of A, if their cost can make it down to $4,000 versus the U of A at $5,000, why wouldn't they get that extra $1,000?
My only experience with that is a good friend of mine. I actually sang at their wedding a number of years ago. She's a nurse, he's a doctor, he's an orthopedic specialist, and they moved out to Penticton, and he could only get 3 hip replacements a month for BC Health, and they ended up moving down into Upper Washington, and he can do 6 a week if he wants.
Wow.
So, the compensation is tied to the, is tied to the procedure. Then you get into, well, if they want to build a private hospital, I mean, look at how much look at how much skin they need to put into the game personally. I think if they do that, then probably there should be no funding or anything by the, by the provincial health service.
And that could be an option
So,
too. We
yeah.
open up a hospital equivalent to Johns Hopkins for those who have the money.
Okay. You, Randy, you build the hospital, I'll build the hotel, and we'll get the money from Brian.
I love it.
It'll be basically a 2-room affair.
Yeah.
Yeah.
I probably wouldn't even be able to afford that.
A fascinating statistic. So let's look federally and on a state level in the United States and a provincial and federal level in Canada.
Right.
Which country spends more public money on healthcare for their citizens? Canada or the United States? The United States spends about 30% more per capita on funding of healthcare for the public than Canada does. And of course, one of the problems with healthcare is that when it comes down to the poor little me that needs the process or the procedure or the service, we want the best equipment, the best doctors, the shortest wait time, the front of the line always.
Right.
And
that's human nature.
That's an expensive thing to fund. Yeah, you get a lot of disparity.
Have you heard anything as to what our lovely Premier Kenny is doing in regards to the healthcare here?
I have no idea. I have no idea.